So in this video we are going to talk about the intervertebral disc in reference to the cervical spine. Now intervertebral disc in cervical spine will make up to 25% of the height of the entire cervical spine. Now no disc found between C0 C1, it's occiput and atlas, and C1 and C2, atlas and axis, there is no intervertebral disc. It is the vertebral disc rather than the cervical vertebra itself will give the lordotic posture to the cervical spine. Now, nucleus pulposus will act as a buffer that will bear the compressive forces applied to the cervical spine, and annulus fibrosus will withstand the tensile forces given to the cervical spine. Now, if you give a compressive forces, it's the nucleus pulposus who absorbs the forces, and when you give traction to the cervical spine, it's the annulus fibrosus that withstand the forces. Now, the annulus fibrosus has nerve innervation at the periphery of the cervical spine that will take the pain sensation in case of intervertebral disc prolapse. Now, we'll talk about the body. So, 7 vertebrae in a cervical spine, but C1 atlas has no vertebral body. That vertebral body will bear the weight for the vertebra above it or the entire cervical spine and the head and neck. Facet joints will bear some of the weight from the vertebra above it if the normal lordotic posture is maintained. But however, even this slight amount of weight bearing at the facet joint will lead to spondylitic changes in the later ages. Now, outer ring of the vertebral body is made up of the cortical bone, where the inner part of the vertebral body is made up with the cancellous bone, peripherate by the cartilaginous end plate. Now we'll talk about the vertebral arch. The vertebral arch protects the cervical spine. Now, spinous process in a cervical spine is bifid in nature, that provides the attachment for the muscles in the cervical spine. Same as a transverse process will provide attachments for the muscles. Transverse process in cervical spine has 2 parts. The anterior portion will have a foramen for the vertebral body, and a posterior portion contains 2 articular facets or 2 articular pillars. In cervical spine, the spinous process is at the same level of the facet joints. So it is very important in order to give PA mobilization or posterior anterior joint mobilization. The facets are same palpable at the level of spinous process. Now, spinous process at the C1 or atlas has no spinous process, or it's at the level of very rudimentary phase. So when you palpate from external occipital protuberance, the first spinous process you hit is C2 spinous process. Now there are 7 cervical vertebra but 8 cervical nerve roots. So this happens because there is C1 nerve root exists between occiput and atlas. So that is designated as a first nerve root or a C1. So in cervical vertebrae, the nerve root is named for the vertebra below it. For an example, C5 nerve root exists between C4 and C5 vertebra, whereas in rest of the spine, the nerve root is named for the vertebra above it. So L4 nerve root exists between L4 and L5. The switch in order occurs between C7 and T1 vertebra, so named as a C8 nerve root, accounting for the fact that there are 7 cervical vertebrae and 8 cervical nerve roots. Thank you.